cancer is one of the commonest causes of death amongst women in India. Every 7 minutes, one woman dies of cervical cancer in India. So obesity is becoming like an epidemic in the society. A lot of women have depressions or anxiety disorders or mood disorders. I'm very happy to see the change that fathers do bring their daughters for menstruation problems, which was not there 2 decades ago. Secondly, when it comes to husband, yes, there's a change in the mindset, because now when they come for their pregnancy checkup at least, then they say we are pregnant. Like, women are pivot of the society. And when any health issue strikes a woman, the whole family system comes to a halt.
Hello and welcome to Frequency 3080, a podcast that takes you on a journey of unknown. Good morning, ma'am.
Good morning.
The science of women's health, a gyno's take on what really matters. I am your host, Brihatika Dev, and I'm here to get this podcast a change, a revolution about what really matters to women's health, whether it's health and whether it's menstruation, whether it's periods, whether it's after a particular age of time. So there are some misconceptions and there are some misunderstandings that we will be clearing today. So today we are sitting down with Dr.Seema Sharma, a leading gynecologist who makes the lives of the women more happier and healthier. Dr. Seema is an obstetrician and a gynecologist. She is also an active member of participating in a number of NGOs talking about adolescence and talking about reproduction and sexual health as well. Thank you so much, ma'am, for joining us. सबसे पहले ये podcast is going to be all about how women should deal with themselves during some particular phase of time. तो सबसे पहले आप मुझे बताइए, how are you?
I'm great.
Everything, life is going good?
Yeah.
Okay. So what do you think gynecology is all about?
See, for me, gynecology is all about, I would say, women's health. Okay. So, but it starts right from the adolescence, through the reproductive years, and after menopause. So gynecology is a very important branch which deals with the woman's overall health, which spans over after adolescence, because till adolescence, pediatricians, they look after children, may it be males or females. But after adolescence, till menopause, and even after menopause, I think gynecologists have a very important role to play in the life of any girl or a woman. Yeah.
Okay. So why do you think you chose to become a gynecologist?
See, I chose to become a gynecologist, and now I'm a primary obstetrician, because obstetrics, is all about delivering babies and delivering these little bundle of joy to various families has become a passion for me. So more than a profession, it is a passion now. So I love delivering babies, and I love being with women through the journey of their pregnancies. As we all know, childbirth is a very important part of any woman's life, and I love being there through their journey and making it a happier journey for them and a memorable event, the childbirth itself. So that is my passion now.
Okay, so your profession turned to passion.
Yeah.
That really happens these days. Okay, so were there any stereotypes back then when you started doing gynecology, started practicing it or something?
See, there are a lot of people who do not find gynecology as a profession very attractive, because one, it is 24/7 job, and many people do not like that, being on your toes always, because as an obstetrician, you will get a call in the middle of the night, you will get a call when you are in the middle of a birthday party, or you are celebrating your anniversary, and it takes a toll on your family, it takes a toll on your children also. So I feel as a profession, it is a demanding profession, but yeah, if it starts giving you that kick and you get that fulfillment out of looking at it, that you are bringing a new life into this world, then that fulfillment outweighs all the inconveniences. So it's a difficult profession, and many people do not take it by choice, but I think there are some people who are born to work for critical care, and we do not mind working 24/7. So that's my take on it. Yeah.
Okay. तो मैम आप बता सकते हैं आप कितने साल से ये प्रैक्टिस कर रहे हैं?
See, I'm into medical profession for last 25 years now.
ओके, सो व्हाट डू यू थिंक कि 25 इयर्स से पहले और अब क्या डिफरेंस है गायनोकोलॉजी में, या फिर अभी आप जिस पोजीशन पे हैं आप अपने आप को 25 इयर्स अगो क्या एडवाइस देना चाहते थे?
See, I think by now I'm quite well adjusted to the entire way of working. You know, so 25 years ago, maybe I did not look at my profession in that way. So when I chose gynae, I used to before that, when we were preparing for the exam, I used to say I will do anything else but gynae. You know why? Because gynecologists are people who were supposed to be very short tempered, and they would always be busy, and they would not have time to themselves. But now by the end of it, I think we are so mature that after spending 5 decades of my life, now I have come to a conclusion that one can strike a balance and you can enjoy your profession, and if you are able to maintain a work life balance, then you are happy doing both, you know. So
Okay, that was really nice, ma'am.
Yeah.
Thank you. And now, as you've said that you've started balancing your life, your career and your work life balance and everything. So what do you do when you're free?
see, my latest passion is about yoga and spirituality.
Okay.
So that is what I have discovered a new love. So I'm enjoying my life, indulging into this, exploring new and new dimensions to this.
Okay. So now the most basic topic, which people want to know, girls want to know, men want to know also these days. What is menstruation and how does it really work? And क्या एज, एक पर्टिकुलर एज क्या है अब मेंस्ट्रुएशन की और क्या होनी चाहिए?
See, menstruation as a phenomena, we all know, it is a process where girls, when they enter into puberty, when the reproductive system starts maturing, then every cycle the girls will have a bleeding, which will, the cycle duration may vary from 21 days till 38 days. This cycle is supposed to be normal. So there is a thinking pattern where everybody expects that the period should be there every 30 days or every 28 days, but scientifically that is not possible. So the normal physiology is that we can have a menstrual cycle which can be 7 days earlier, or it can be up to 38 days, and that cycle will be considered as normal. Now what happens is, we all know that the female reproductive system has a uterus, we have fallopian tubes, we have ovaries, and as a result of the ovulation which happens in the ovaries, if there is a pregnancy, then the menstruation stops there. But if that egg which is released on day 14 of the menstrual cycle does not get fertilized, then there will be a withdrawal bleeding. So the lining of the uterus is shed, and after 28 or 30 days a girl ends up having a menstrual cycle which is in the form of bleeding, which will last for 3 to 4 days every month. So that is what menstruation is all about.
Okay. So ये तो biological aspect हो गया. अब एक emotional and psychological aspect क्या connected है इस particular menstruation periods? What do you say?
See, there's a hormonal change which is happening during the menstrual cycle. So there are two important female hormones which are called estrogen and progesterone. Now there is a spike in the level of estrogen and progesterone, and when on mid-cycle there is no fertilization, there is a decline in the level of hormones. Now the up and going down of the hormones, these hormones also have receptors in our brain and our nervous system. As a result, there is a condition which is called premenstrual syndrome, in which most of the girls, most of the young girls, or even women in their reproductive age, they will have various, changes in their moods, changes in their emotions, change in their energy levels just prior to their menses, which is called a PMS or a premenstrual syndrome, where a girl can be irritable, she can be very moody, she can have few acne on her face, she can feel very bloated, she can feel less on energy, and sometimes some girls during their period, they have a lot of vomiting and nausea because of the pain they undergo during every cycle, and they may have discomfort which is called dysmenorrhea or the painful periods. So all these things, they are associated with the hormonal change which is happening because of the menstruation.
Okay, so this was like the psychological. ठीक है, तो इमोशनल क्राइटेरिया है कनेक्टेड पीरियड्स के साथ,
Correct.
दैट्स नॉर्मल,
Yeah.
दैट्स नॉट एन इशू. तो एज अ डॉक्टर आपके पास पेशेंट्स आते हैं ये बोल के कि वी गेट लॉट ऑफ हार्मोनल चेंजेस या बहुत इमोशनल हो जाते हैं, वी आर नॉट एबल टू हैंडल आवरसेल्व्स.
Yeah, a lot of girls, they do come to us. See, there are because as I was describing, in the premenstrual syndrome, it can start with disturbance of the sleep. There can be tenderness in the breast, which is called mestalgia. So a lot of girls, they come that they have painful breast prior to their period. Then their mood changes are there, and painful periods is the condition. So see, we always try to evaluate a person holistically. So when a person is complaining of mood changes, so some amount of mood changes are there which are mild. But if somebody is complaining of excessive crying or negative thoughts, then we would definitely want them to be evaluated by a psychologist कि कोई underlying depression तो नहीं है. Because nowadays mental health issues are very common and sometimes they get exaggerated in the premenstrual phase. Then for the low energy levels, we like to evaluate their hemoglobin. Most of the young girls in our society, they are anemic. When a girl is anemic or she's got a low weight, she has got a low BMI, then also they will feel more symptoms. So we like to look at the overall health of the person. If there is less hemoglobin, we will supplement iron. If their vitamin D levels are low, we will go for that supplementation. If the person is having a thyroid dysfunction, we would like to correct that. And then we can give them iron supplements, calcium supplements, and advise them that they should have a better lifestyle. Like if people are exercising regularly, they are not binge eating on chocolates and high salt intake, their symptoms of bloatedness and all will be less. So we definitely counsel them about diet, about regular exercise, and if there are any deficiencies, they are corrected.
Okay, so now what is the average time period कि कितने दिन periods आते हैं?
See, it can vary from anything like 2 to 3 days to 7 to 8 days.
Okay, and does blood flow vary? Like कितना
Yeah,
blood
it is
flow
very
होना चाहिए?
variable for different people. Some people have a heavier blood loss, some people have a very less blood loss. If any amount of bleeding is not affecting the hemoglobin, like average hemoglobin a girl or a woman should have is around 11 to 12. If one is maintaining their hemoglobin between 11 and 12, then whatever the blood loss is there, it is okay for that person. But if the hemoglobin is dropping to less than 10, then definitely we need to look at the cause, that why periods are excessively heavy.
Okay, and does stress affects the blood flow?
Yes, of course, stress affects the menstrual cycle. It can affect the blood flow because stress overall is not good for human beings, for anybody, maybe male or female. In females, sometimes excessive stress can interfere with the regularity of the menstrual cycle. It can even interfere with the amount of blood flow. So it is seen that women who are under stress, sometimes they have heavy menstrual periods.
Okay, fine. Alright, so what kind of misconceptions do you think आजकल women and ladies these days have? कि क्या ऐसे myths है जो उन्हें लगता है कि इसकी वजह से ये हो रहा है हमारे साथ?
See, a lot of time people feel that they have scanty periods, means less amount of blood flow, and they think that they are becoming obese because their period is less. This is a very common misconception we face these days because obesity is becoming like an epidemic in the society and a lot of people are overweight. So they always relate it to कि हमारा पीरियड बहुत कम आ रहा है इसलिए हमारा वेट गेन हो रहा है. Whereas the truth is, the scientific fact is, it is the other way around. Whenever people gain weight and they become obese, they end up having hormonal imbalances. As a result, their period becomes less.
Okay.
So this is one very common misconception which people have.
Okay.